Sir, we are live now. With all your permission, I'm starting this session.
Yeah, please go ahead.
Good afternoon, everyone present here. I welcome all the participants on today's session. And let's welcome today's speaker with great honor, none other than Professor Dr. J. A. Jayalal, sir. Sir has done MS, DLS, FIAGES, FMAS, FICS, FSCS from USA, MBA, FIIOPM, and DLS from Germany, and PhD in surgery, FRCS from UK, and postgraduate teacher, professor and HOD of surgery, Kanyakumari Medical College, Nagarcoil. Today, sir is going to discuss on a topic paradigm shift in healthcare delivery on the occasion of National Doctors Day. Let me tell you overview of the topic. Paradigm shift in healthcare delivery, where leading experts and healthcare professionals will discuss the transformative changes in the healthcare industry, explore innovative approaches, technology integration, patient-centric care, and the impact of global event on healthcare practices, gain valuable insights into shaping the future of healthcare and ensuring better outcomes for patients in the dynamic and rapidly evolving landscape. Take advantage for this opportunity to be a part of this conversion. Now I would like to invite sir and hand over this session to sir. Over to you, sir. Kindly proceed from here.
Thank you very much for this opportunity to be with you. I would like to share my slides and okay. So thank you for this great opportunity to be with you, and I am extremely thankful to be with you at this moment. It is a great Doctors Day that we are celebrating, and this Doctors Day, as we are celebrating this Doctors Day, there is various programs are being carried out in the country in the commemoration of the Dr. B.C. Roy's memory. At this moment, it is my pleasure to talk to you on a topic on the paradigm shift in the healthcare delivery. I have some difficulty in finding the noise. Okay. Just okay. So it is always a great pleasure that when we are knowing that after a great service of Dr. B.C. Roy in honor of his remembrance, and we are celebrating this Doctors Day, it is always a pleasure to know the greater contribution he has made to the society in the form of being a great teacher. I belong to Indian Medical Association. I served as the president of Indian Medical Association in the 2021. So with the 4 lakh doctors as members and the 1,800 branches of the Indian Medical Association, I bring to you greetings. I also belongs to the Commonwealth Medical Association, which is the conglomeration of the collective consciousness of the 56 countries in the world, and this medical association. I'm serving as the Secretary General, and I also bring the greetings from all these countries on this blessed Doctors Day. It is a pleasure and it is a privilege for us to see the great services rendered by the great people. One of the great legendary person, Dr. K.K. Agarwal, in his memory that we are celebrating or honoring his great contribution to the healthcare. A small hitch is there, and I think it will be settled. We are always fascinated to the great services of Dr. K.K. Agarwal, a Padma Shri, a man till his last breath to serve the country, and especially on the COVID and it is related event, however the services which are rendered by him are praiseworthy. He is a role model. He always encourages the people to go forward. So IJCP, which is doing a service and which is his brainchild, is doing a great service in continuation of his, in remembrance of his great work. So I salute the legendary leader and Dr. K.K. Agarwal sir on this precious moment. And we all know that this is a Doctor's Day, this we have discussed. Okay. The topic which I am going to serve to you is a paradigm shift. A change from the one way of thinking to another way of thinking. So normally that is what is going to help us in understanding what we literally mean by the paradigm shift. So there was a lot of good things that are happening in the healthcare delivery system. But of late, with the newer technologies coming in, newer understandings coming in, so a lot of changes are coming in. And with that changes, the understanding of the health concept and the understanding and the sorry, just a minute. I just not sure what is happening with my computer. Pardon me, because there is some hitch is there in the computer, because probably we have to think some other paradigm shift on that. So the idea behind of this talk
Sir,
is going to
sorry
be
to
on.
interrupt. You can, sir, minimize the presentation and just
Yes,
run
that
it.
is what I'm going to. I'm trying, but it is not escape is not coming. It will take, I think, 1 minute. There are a few aspirations we have on what we expecting the paradigm shift will be do the result. In certain areas we have achieved the results, but certain areas definitely that we are yet to make a lot of changes in the country. This is an evolutionary process. If you take the healthcare delivery system in our country, there's been chronically going on a change. In the olden days, in the 19th century, when there is a modern medicine was started being practicing in this country, it was mainly the home-based care. The physician will go and visit the house of a doctor. Nearly 60 to 70% of the medical care was on the home base. It is not that the patient comes to the doctor. It's invariably the doctor going to the house, conducting the deliveries in the house, giving some treatment in the house. So that was the 19th century model of the healthcare delivery system. And then slowly it was changed to a doctor-centered or a hospital-centered practice in the modern medicine, the pinnacle period. When it was modern medicine was coming into the pinnacle, and it was shifted, that is the focus. The doctor, instead of going to the house of a patient, it is always the patient is expected to come to the hospital. So mushrooms of the hospitals and the corporate hospital has come out where the people were expected to come. Hospital has become a 5-star hotel like thing, and the people were asked to come to the hospital and enjoy the hospitality sector more than the combination of the corporate management system. But what is the paradigm shift we have envisioned, and what is the paradigm shift which is happening today is understanding. It is from the hospital-based medical care or a doctor-based medical care or a disease-based medical care. It is a person-centric medical care. That is what is a great paradigm shift which has happened in the shift of the medical care which is happening. So instead of taking from the house-based, hospital-based, now to the person-centered, again the person-centered has been transformed into a person-centric, a genomic-centric, or the precision medicine-centric. Even if you take the changes which is taking place in the surgical field, then initially we were operating on an organ. When there is an organ is diseased or when the part of the body is diseased, the entire organ was removed. Now later the tissues were removed. Now we are living in a stage where we will be able to do even a psychological or a small a tissue or the cytology, the cells can be identified, which is been creating the problem for the persons, and that is what we are exactly doing for that. So this is a one paradigm shift which has taken place, a home-based care to the person-centric, even person-centric also term more of the precision-centric healthcare, which is concept. So this is one shift which we will be talking today. The second is understanding of the health itself. And previously it was thought that the health is only a mere absence of the disease, and where the people thought it is when the person is not having some disease, when the person is not having some problem in the body, then definitely he is being called healthy. When there is no fever, when there is no cardiac problem, when there is a BP is normal, the person is considered as the healthy person. But the understanding has changed with the definition which is coming in the new dimension of understanding the health, where it has been stated, it is the health is not a mere absence of the disease, it is a state of a complete well-being of an individual, not only on the physical well-being, it is the well-being of the individual, both on the positively on the side, on the physical side, but also importantly on the social side, his mental side, and the spiritual side. Only when the person is coming into the holistic view, when the person is coming into the an understanding of the positive health in the all parts of their life, and the person will be considered as a healthy. So this has led to a phenomenal change in the paradigm shift in the healthcare delivery, where it is not mentioned that only the curative, the physical part, other component of the health, which is the sanitation, which is the environmental pollution, which we are having, the good hygienic water supply, the shelter for the patient, the atmospheric air what we are breathing. So all these are become the component of the health, and that has been now brought under the health ministry to understand that this is also an important part to understand how the things will be happening. So this is the next, because of the important the paradigm shift which has happened, then how the health is normally understand here. The third part of the paradigm shift which we are getting is how this being implemented, the understanding of the disease pattern itself, what type of understanding we are having on the disease pattern. The one and most important the disease pattern which we thought is olden days, it was only there are two kinds of a disease pattern which we always talk. One is a contagious disease or infectious disease, and another one is a non-communicable disease. So this has come to a conclusion where we started talking about a non-communicable disease and the communicable disease pattern. There was quite a lot of people in the olden days. The people started dying because there was no much of antibiotic were there, not much of treatment cure were available for the patient. So the patient has to die when there is some infection. People were dying in front of the eyes of the doctor when there is a pneumonia was setting, when there is a tuberculosis was setting, when there is a malaria was setting. There was not much of medicines, not much of treatment is available. So the person has to succumb to death. But slowly now we understand the concept of the contagious or the contaminated or infectious death is slowly changed to the non-communicable disease health, where the non-communicable diseases are contributing the majority part of the healthcare delivery system. If you see today, the 100 people are dying, 60 to 70% of the people are dying because of the non-communicable diseases. There are only 4 major non-communicable diseases which has been identified, which is the constitutive reason for the 70% of the death which is happening in the country. That is the cardiovascular disease, the respiratory tract disease, the diabetes, and the disease related to the oncology or the cancer disease. If you see, the majority of the non-communicable disease or the cause for the deaths of the people who are happening with the non-communicable disease, they fit into this. Either it could be belong to some of the cardiovascular disease, whether it could be hypertension, whether it could be a coronary artery disease, or whether it could be something problem with the thrombosis pattern which is happening. The second most component is the diabetes and the related complications. There is no organ which can be spared with the diabetes, and once you get the diabetes, and he is going to get a lot of disease, a lot of pattern with the diabetes is going to be there. The third part is the oncological problem, is a cancer related thing, and the fourth is the respiratory tract. The most beautiful thing in this is there are 4 major diseases. Equally, there are only 4 major causes for this. And if you see, there are only 4 major causes for this non-communicable disease, which we can say it is one is alcohol intake, the second one is smoking, third one is obesity, and the fourth one is a sedentary lifestyle. And all these are interrelated. There are 4 major diseases. There are 4 major causes. And for this, and if we can have a control over these 4 habits of controlling over the alcohol, controlling over the smoking, controlling over the dietary habits and the lifestyle of the individual, whether the patient is having a sedentary lifestyle or the patient is having the lifestyle which is very active and he is doing a lot of work which is related to the active. And that is going to decide on the future. And the food which he is eating, the most majority of the time, the junk food which he is taking, the spicy food which he is taking, the food which is the natural food, which is carcinogenic food, which he is taking. So that is a great paradigm shift which has taken from understanding that we are not only bounded or studded with the diseases which is pertaining with the diseases of the infectious origin, but the diseases which is pertaining to the majority of the cases with the non-communicable disease. So the efforts of the government and efforts of the healthcare delivery system has changed from the just focusing and identifying an infection to identify the non-communicable disease pattern as a major component of the patient. And the hospitals have started in doing the viability examination, started doing the basic screening of the people, the diabetic profile of the people has started being collected, the hypertensive profile is being collected, the line is being maintained. So now everybody is now given a card where they will be knowing that what is the status in which they are there, but thereby the government is able to take a positive decision that how best they will be able to take bring down the amount of the disease pattern can be how much they will be able to reduce it. So that is another important disease pattern which has taken place in the healthcare delivery system. So with this paradigm shift and the concept, I mean, why we are thinking about this paradigm shift is needed and why we are talking about that, because we were able to see the prime importance of the healthcare delivery, which is affordable, accessible, and equitable healthcare delivery system. And if our healthcare system delivery is affordable, equitable, and if it is based on the principle that where we will be able to say that all the people of our country are able to get a full-fledged accessible care, and there is no necessity for this. But now we are sure that there is not every person of this country is not able to get an affordable health care. Every person of this country is not able to get
the full-fledged recovery from the bed. So that has been the major reason in understanding the issues of the paradigm shift is coming. There's two important words which is important in this talking. One is an equity and equitable. And this, when we are understanding the healthcare delivery system, and these two words are important because we are not only talking about the equitable, but also the equality. There is two different words when equitable and equality. Equity and equality. Equality is when we have some program and some resource in our hand, and we are providing the person the equally when we are distributing that it is called the equality. But what in the healthcare delivery system, what we are expecting is an equity care. It may not be a equal way of distributing things, but the need of the person for each system is different. Somebody needs to have a major share of the care, especially the marginalized people, especially the people who are geriatric, especially the people who are in a pregnancy or the immunocompromised people. When the people are in a comorbid state, they need more focused care than equal care in a village, in a society, and identifying a person who is having a more problem and doing some great service to the focused way is what we are understanding about talking about the equity of care. So the general principle when we are talking about the understanding of the distribution of the paradigm shift, it is mainly on talking about the equity of the healthcare delivery system on that. So that is a basic principle with which that. So when we are talking about the personalized care, when we are talking about the care which is related to the person-centered care, the most important thing which is coming in an hospital setup, what we are now understanding with an hospital setup, and an hospital is being projected, and hospital is being dotted as a most unsafe place in many of the situations. If you see the total number of challenging or total number of the accidents or iatrogenic problems which are happening in the hospitals are unique, and it is a large chunk. And so the primary concern of the hospitals are now shifted from the not only taking care of the person, but also taking to the situation where we will be able to provide a safe environment for the patient. So the priority of the concern has come for the patient safety as a priority. Yes, it is indeed that we are going to give the healthcare delivery, but the most importantly, the patient has to take a care where the patient safety is there. The patient who is coming to the hospital, person who is able to come to a situation has to get into a safety, patient safety concept. So that is one area where now the more focus is gone there. So for that, there are certain things and each hospitals will do. If you see the previously, when we are talking about the patient safety, the most important thing which has come is the NABH accreditation or the hospital accreditation, which is coming into the major role to the play. For one of the basic principle which is coming is the NABH accreditation is the patient safety. In the patient safety, we mainly talk about the three roles which we talk about. When a patient come to the hospital and he is able to heal, the environment or the built environment which is there is providing a safe environment to him. So if that is not being able to provide it, so this will be able to give a great change. Excuse me, can I shift to the new another phone? Sorry, can I shift to another system?
Yes, sir, you can. I have.
Hello. Sir, I can't see. Yes. I am just trying something as I don't know what happened. Oh. Are you able to see an answer? Hello?
Yes, sir, I can see the slides. You can continue.
Okay, sorry for that. I will not do that. So, friends, I'm extremely sorry that there is a technological problem. So, the challenges which we face in the healthcare deliveries is mounted by the increased amount of the population which we are having. We all know that today the India has surpassed the China's population. But the most worrying thing which we look into this slide is, and even in 2100, it is projected that India population or Indian system will go to the level of 153. But if you see the China, it will be by the 2100, they will come down to 76.7 in China in crore. So that is a phenomenal step which they are taking. Said it is projected that China's population by the 2100 it will only become the 76 crore, but our population will continue to grow and we will be reaching a level of 153. So unless we decide some paradigm shift and some approach change in the healthcare delivery system, it is going to be a great disaster for us. But one of the things which I have already discussed with you is the person-centered, aging population which we are going to have. The people with the specific needs are going to be increased with the population. The people with the economic concerns and the progress which we are going to have also going to be increased. The demand and efficiency or the demand versus supply is going to be more. Technological advancements which are happening. So all this put their change in the concept of the paradigm shift. The few important areas where we are able to see the focus of the paradigm shift on this country. Now the government of India has started about the, instead of talking about the primary health center or the primary healthcare hospital, it is a wellness center. That means that we are not talking about the health, but we are now talking and focusing on the wellness. It is a comprehensive wellness of an individual where he will be able to have a positive feeling in the social, mental, and spiritual way. And similarly, then most of the time when we are talking today, even in the COVID, when it is coming in an unstructured way, unexplainable way, that we have reacted to that. But what the intention of the paradigm shift is to the proactive level, that we need to predict and what is going to happen. We needed to predetermine and how the changes are going to happen and make some changes in the way in the proactive level. And most of the time, the hospitals or the healthcare is focused on the curative resection, the physical curative resection. But what we need to now focus on the paradigm shift is on the preventive aspect. How best that we will be able to avoid. A person may have a diabetes, person may have a carcinoma of the esophagus, but how best that we will be able to give a good life circumstances, prevention of the complications related to that. A patient may live with the diabetes for a long time without any complication. It is not that we are going to talk about the curation or the cure of the diabetes, but we are going to talk in terms of the prevention of the complication of the particular thing. And it is an ongoing process. It is not the spike of event. You have a fever, you come to the hospital, and where I'm going to treat. But it is a continuous monitoring of the patient, which we need a lot of changes. And based on this, only our paradigm shift changes are going to come. Now we are going to have the continuous medical record, continuous electronic data. So all that is based on the principle that we are not going to talk about the acute care. We are going to talk about the continuous care. And as I have been talked earlier, it is a doctor-centric approach is changed to the patient or the individual-centered approach is going to be there. Hospitalized care is also going to be the extended hospital, or the boundaries are going to be delayed. So these are the basic principle on which that normally that we are going to talk about the diseases or the take. And if you see what is the healthcare achievement of India, yes, indeed, India had gotten a great healthcare achievement. And if you see India when it got independent in 1947, and the life expectancy of the people who are living in this country was only 37 to 40. Today, the life expectancy has gone up to 70, 73. If you see Delhi, it is 74.3. Kerala, it is 70.3. The life expectancy has phenomenally increased in this country. That has been because of the service of the healthcare delivery system. The maternal mortality rate has come down very drastically. The infant mortality rate, when India got independence in 1947, and if the 1,000 children are born in this country, 250 child cannot see their first birthday. That means that amount of infant mortality was there. Now it has come down to 13, 14. Tamil Nadu, it is just 13. Kerala, it is only 12. And Indian overall average is 20. So we have achieved something, tremendous achievements in the healthcare we have achieved. But what is the problem in there? this achievement is not equal, or there's no skew distribution of that. If you see urban and rural gap, rich and poor, the divide is a tremendous in that. So the paradigm shift which we need to understand is an equity and equality of the health. It's not that somebody who is in the metropolitan city, somebody is living in the Kerala, somebody who is living in Delhi or going to get a health. Anybody, even the person who is in the Jharkhand or the person who is in the Patna, should experience a positive health, and then only we will be able to say that the health achievement of the India is going to high. So the gap which needed to accessibility of the people has to be improved. The affordable, accessible, and the quality of the healthcare to the every segment of the population has to be become a for that, the change has to come. The change is inevitable, and that why the paradigm shift is coming for this to achieve the equality care. See, there are one of the very, very famous book is this book, what we talk about, that the crossing the global quality system. And that talks about the 6 important character feature, and that will be able to give an equity and equalities, including one is important in the healthcare is the safety of an patient, timely intervention which we are going to give, effective care which we are going to give, efficient care which we are going to give, equitable care, and the person-centered care. So the paradigm shift which is envisioned and which is being practiced, which is being followed, or the ideas are propagated, is based on this principle of these 6 where we are going to talk about the health. This is what I discussed about the equity and equality. Equality is here, there is a matches going on. The 3 people with a different calibers, one is so tall, one is so short, all of them are given an equal height stool. And when they stand, the end result, the person who is too short will not be able to get. Though it is true that he has received the equal share. He has received the equal amount of care which is given to the tall person is given to him. But ultimate result is nil, that he is not able to get a positive. But when you talk about equity of care, this person who is tall, he may not need a support. But the person who is short, he needs a bigger support. So this is the priority concern in the paradigm shift when we are talking about the equity of the care which we are able to provide to the individual is going to become a most important thing in the deciding feature of that. And this I have told that the century we are changing to the person-centered medicine. That is going to be a major change. The second most big paradigm shift which has taken place in this country to reach this equity of care, to reach this quality-oriented healthcare delivery system is here. And we need to have equally the medical education to need a paradigm shift in the look into that. And what was there originally and what was being provided today, and with this provided only with the intention of providing that. This is one of the very famous statement by Dr. Bernie Siegel, who said, every individual entering into the medical education, we know that it is those who are getting the NEET UG with the top rank, where the cream of the society is entering into the medical education. But after 5 years, when they are coming out of a medical college, and most of them are devastated, they are frustrated, they do not know what to do, what is the next goal, next target. And this was a system going on for a long time. People were there, and whatever is opportunity come, and they were joining there. So based on understanding this, there is a curriculum as brought into the medical education that we call it as a competency-based medical education. And this is one of the great paradigm shift which is being envisioned in the medical education with the focus of reaching the quality achievement in the healthcare delivery system. And it is also defined and what the intent, our medical education intend to have, an Indian medical graduate who is possessing a requisite knowledge, a skill, attitude, values, and responsiveness, that she may function appropriately and effectively as a physician of first contact of the community while being globally relevant is the objective which is being put on that paradigm shift. And it was not defined earlier, but this is one of the opportunity. And it is well defined, a paradigm of the competency-based medical education, healthcare delivery as a goal. To meet the goal, that every graduate has to play a role, and to reach the role and to perform those roles, they need certain competency. To the competency, to achieve the competency, they need to have certain objectives, and that need us. These are the principle in which the changes will be taking place. And it has been also well defined. A medical graduate, Indian medical graduate, when he is going to come out, and he needs to play a major 5 roles. He is not only going to be a clinician. Yes, it is welcome, but mostly he has to be a professional. He has to be a leader. he has to be a lifelong member, he has to be a member of a healthcare team, and a communicator. All these 5 roles, a medical graduate has to understand, learn, competency he has to achieve to provide a comprehensive change in the society. The third paradigm shift we are having the therapeutic approach, which already we have discussed about the communicable disease and the non-communicable disease and how the things are going to change. And definitely that is a big change we are having. But the paradigm shift which we are now taking place is a telehealth or enhanced accessibility. And with the advent of the modern technology in the television or modern technology in the fiber cables which are connected, the connectivity which is ensured. Now, telehealth is coming as a major when there is a people in person, somebody somewhere cannot reach, a specialist cannot reach, but definitely through this technology, the telemedicine can. Interestingly, when you look into the history of a telemedicine, when the Graham Bell, when he found out the telephone, the incident was on an emergency medical help, and he called the Watson and said that I need a medical help. So it was quoted often that the first call ever made in a telephone is for a medical help. So today the telephone or the telecommunication with advanced things are creating a greater role in the understanding and how the health can be developed on that. That's a telemedicine has a tremendous impact it has. There's 2 important words which we now talk in a very commonly is M-health and E-health. And the part of the telehealth, all this comes under the telehealth. But M-health is the one part which is being now every individual in this country is many of the time they have more than one phone, connectivity, smartphone is there. And there is no village, no area where we can say that the connectivity, the phone has not reached. So mobile health or through the internet, through the cell phone which the people are having, the paradigm shift is there to the healthcare inputs, healthcare monitoring, healthcare support, healthcare advice, healthcare, the hand holding, all this can be take place in M-health. Another one is E-health, that is internet-based health. By the various ways of internet, we can do that. And also there is the health records all looking with the National Digital Health Mission is doing a great job there. And we have a lot of advancements in that, ICU, point of care diagnostic, and most importantly, the most accessible or the most the positive change which has taken place in the telehealth is affordable and medical devices, wearable medical devices. Now we look in general to any society, anywhere in a college, most of them are wearing a watch which have how much step they walk, how much calorie they take. All the details are being monitored. So wearable health devices has made as a part and parcel of the healthcare delivery system in this country. Millions of millions of startup programs are coming up. Newer agencies are coming in and providing the startup program of the telehealth. So this is another major change which has taken place in the telehealth concept, which we are talking about. That another paradigm shift is understanding on the human resource management. And previously we said it is there was not much discussion because hospitals were considered as only a doctor center. Doctor is considered as a top man and he is a jack of all trade and whatever he thinks is right. That was a concept which was prevailing there. So doctor will be deciding factor. But now everywhere a specialist has come. It is from the doorman to the bellman or the sweeper, and he need to be special in that, which a doctor cannot play a role. It is always a teamwork. So this concept of teamwork has come. It is not a doctor, compounder, or a pharmacist and the nurse. It is the entire team working on that. People and the hospital industry has understood in the healthcare delivery system, the most precious person is a human being. It is not that the person with the instrument. It is not your ECG. It is not your CT scan machine. But the human value, the human system, man in your system is the most important. I always used to say the depreciation and appreciation. When we calculate our record at the end of the March, and when we say we have an ECG, last year its value was 20,000, and after the 1 year, it will become 15,000. But a person, a nurse or a pharmacist is working with us for 1 year, his value will always appreciate. It will be never depreciate. So the human value, human resource understanding, and hiring the people and training and keeping them with us, a continuous monitoring and upholding them has become a major. I often used to say the wine and work case get better with the age which they are there. But equally, there was a lot of issues that talk about the manpower shortage and everywhere. But unfortunately, what has happened in this country? Now, we talked on one side, there is a shortage of the doctors. And for that, there is a huge development in the medical colleges have opened up. Now 654 medical colleges. 387 was the college in 2014. Now we have a 654, 110,000 medical students. Do we really need them? There was a big study. We always used to say the study of 1,000 population, 1,000 patients or 1,000 people need a doctor. But if you see, look into this picture. Tamil Nadu, now with the number of colleges, number of so much of people we have, for every 253 person, there is a doctor. This is not a report. It is a statistical statement which has come in an international daily paper, which says that Tamil Nadu has 253 or every 253, and we have a doctor. That means there's a things are going to happen with the people in the south when there is a more medical college, more doctors for the less number of patients. The unemployment is going to come. On the contrary, if you look at the Jharkhand, where we are having for 8,180 people, one doctor is there. Haryana, we have only 6,337 person, one doctor is there. This is a big challenge of India today. When we talk about the manpower, there are enough doctors, nearly 13 lakhs doctors are there registered, and every year 1 lakh doctor is going to come. The shortage, there is no actual shortage is not there, but the skewed distribution is not happening. There are various reasons. It is not the problem with the availability, with the government, local governance, everything plays a role. So, but this inequality is a focus where we need to have a paradigm shift for the understanding. It is not the increased number of the colleges that we need, but the colleges has to have the skewed distribution. The states like Jharkhand, where there is a number of doctors per patient is going to be very less, and they should have a more medical colleges. And state like Tamil Nadu, Kerala, there is enough doctors for given a small number, more than what we expect. 1,000 patients, one doctor concept has changed now to 250 patients, one doctor. So this is another paradigm area where we need to concentrate and how we are going to take care of this situation there. Every country has a shortage, but we need to go beyond that. And another major paradigm shift in understanding in the healthcare delivery is a One Health approach. And this is one of the human ideology. What is the health of an individual cannot be sustained unless his environment and the people surrounding him is healthy. So understanding that, it has made a system, a sequential event for a human to be healthy, animals has to be healthy, and the environment has to be healthy. So all this put together, the concept is called One Health concept. A lot of efforts are going on in the government to start the One Health ministry. A separate ecosystem is being created, separate ministry, the segment of the ministry is created where the zoonotic diseases, the environmental conditions, which interconnect with the human diseases are studied in depth and understood in depth, and remedial measures are thought out. So One Health approach is one of the golden concept of the paradigm shift which we are ensuring. If you see emerging infections of the zoonotic diseases, vector-borne diseases, or we talk about the antibiotic resistance which we are having, the food safety and security issues, all these are interconnected with the environmental health, the mental health. So this all put together the One Health issue. November 3rd is celebrated as the One Health Day, and that will be everywhere. The another important area where we are concerned about the global warming and the climate change which is taking place. Health is also affected in a big way. A lot of issues with the health is there. Not only the health, the climate change affect the health, but hospitals itself is a source of the climate change which is happening. The healthy hospitals can keep a healthy planet. There are a lot of areas in the hospitals where there is a lot of carbon dioxide emission, right from the number of vehicles coming into the number of food you are going to use, even some of the drugs which you are using, volatile gas which you are using in anesthesia, all this plays a role. So we understood the paradigm shift in that. We understood the concept of the climate change, and now we are a lot of efforts have been understood that about making the hospitals reuse, reduce, recycle, the concepts are there. And hospitals are now advised to understand the healthcare delivery system where they also sensibly do certain works to see to that they are able to preserve the nature and society. Another positive paradigm shift has taken on the biomedical base. 15 years back or 20 years back, if you see none of the hospital waste were segregated. All the waste were put together. There is only 10 to 15% is the biomedical waste. When it is mixing with the entire hospital waste, there's a lot of challenges there. So many steps were taken by the government. Now, if you look into majority of the hospital, even a small hospital, they understood the concept of the biomedical waste. They understood the concept of segregation. There is a proper methods and documentation and monitoring system is there to how the biomedical system is maintained. So that classification of the biomedical waste are being done. So all that is helping us in the building a new positive health in that. So understanding of that. I must also talk about a new dangerous changes which is taking place in the paradigm shift is the understanding of the government towards the mixopathy, which none of our doctors, we are not against any system of medicine. Every system of medicine is unique. Every system of medicine is special. And a man, and when he is in a healthy, unhealthy, he may needs the support of a different system of the medicine. He may needs an Ayurveda, he may needs an Unani for a different system. But what is the difference between Indian Medical Association saying is every system should have a specialist and that specialist should give that medicine. But the government wants to do, one doctor should learn everything and he should give that. That we call as the kitchadification or mixopathy. And that is one of the major setback to the modern medicine or the healthcare delivery system, where mixopathy is going to affect us. Mixopathy is going to talk about. I already talked about the patient safety also. There are various steps we take to the patient safety on that. Finally, I must say that one of the greatest paradigm shift that's taking place is the Ayushman Bharat system, which is envisioning that more than 50 crores of the people of this country is given an opportunity to get some benefit from the government. There are a lot of issues on that. Practical issue, the rate is not adequate, the hospitals are not, all the hospitals are not embedded, but still by concept, by the way, the paradigm shift in the thought which has created, the monetary financial issue is the one issue which is not making the people to affordability of the healthcare. Ayushman Bharat is doing a great job in doing the great help to that. And finally, I must say that the most important paradigm shift which we wanted to get for a positive change and positive health for all concept to be achieved is the public health spending should be increased. Now, today, the government of India is spending less than 1.5 of the GDP for the healthcare. It is comparatively very low among any developed countries. US spends nearly 14.3, Japan spends 9.2, Brazil spends 3.9, and even China spends 2.9. But unfortunately, India spends less than 1.5. And this is a one area of the paradigm shift which we are envisioning, we are hoping, we are trying our level best to see to that the government will be able to allocate more funds for the healthcare. And if there is a more funds have been allocated, definitely that we will be able to do that. Friends, finally, I must say, it is not that what is the when we talk about the person-centered medicine, and we must understand what satisfies a person as a healthcare delivery system. And this was a big study with a large population done. And when a patient is coming to an hospital, the immediate attention at the reception, care first and then paperwork, knowledgeable people greeting them are the top priority of the concern of a patient. So the healthcare delivery system should also give much importance to that. If you see the last state-of-the-art equipment, physical facility, easy to find, all these have only a very limited focus. When we are talking about person-centered or the patient-centered medical care, we should be aim our planning, aim our hospital infrastructure, aim the implementation of the healthcare with the concept. What is the human manpower is the most important, human care is the most important, and that should be the priority should be given. And if the paradigm shift is taught on that level, definitely we should be there. Second most avoidable paradigm shift we are looking for is a violence which is taking place on the doctors, violence taking place on the healthcare professional. This is the one area which is paining us, wounding us. A lot of doctors, a lot of people are being assaulted and abused. And we hope and wish the government and the people will understand the importance of that. There will be a paradigm shift will take place. The people will be able to understand the people, understand the doctors, their service, especially on this Doctors' Day. Nowhere, no country, Teachers' Day will be celebrated by teachers. It is only the students who got benefited will celebrate. Father's Day will not be celebrated by fathers. It is the son and the daughter will celebrate the Father's Day. Unfortunately, the Doctor's Day are being celebrated outside by the doctors most of the time. When the people understand the service of a doctor, when the people know that this amount of commitment service doctors are doing, if they understand that and provide that healthcare, and what a beautiful situation it will be. And that is what the paradigm shift we are looking for to take place. The people understand the needs of the doctors' healthcare delivery system, and then definitely we will be able to get to the positive health. And there are so many things we can talk, but mainly, and we will talk about the patient-centered care. We are incorporating technology development into that. But the paradigm shift we are envisioning is more public health spending, more uniform or the purity of the system, where the healthcare of the professionals are provided free atmosphere. And I often used to say the health of the country depends upon the health of the professionals, and that if the health of the professionals are envisioned, definitely we will be able to see the health for all concept. The people will be able to get a positive health, and then the people will be able to get a good health, and that is a dream project for us. So I wish on this Doctor's Day, and this paradigm shift which we have envisioned will lead us to a say where everyone, it is not only the patient, the doctors, the community, the society, the government, everybody should be healed, win-win situation. All of us should feel positive health in our life. And that shall be the paradigm shift which we are expecting in the healthcare delivery system. Thank you very much for your patient hearing. I'm extremely sorry for the initial delay, hiccup which has taken place in the slide presentations.
Thank you so much, sir, for giving your valuable time and sharing your knowledge with us and making this session informative one, sir. I definitely think this session knowledge is going to help all the participant doctors who have joined this session, sir. I can see, sir, we have received some question from the participant. If you allow, can I take this question?
Yes, please.
First question I can see from Dr. Anubhav. He is asking, what are the key aspects of healthcare delivery?
The key aspect of healthcare delivery. So key aspect is only 3 words: affordable, accessible, and quality care. And if we can say that nook and corners of our country, and if we can able to get with their financial stuff, they can reach to any hospital, they can get any help which they needed. That is the day we will say the healthcare delivery system has achieved its target. Ayushman Bharat is helping us in that way. Number of doctors availability is also helping in this way. So mindset and the shifting of understanding, the win-win situation, each one hand holding with each other will definitely lead to that situation.
Thank you so much, sir, for answering it. I can see some more questions are there. Another question from Dr. Kumar. He is asking, what's your point of view on impact of teleconsultation and remote patient monitoring?
Yeah. See, now it is teleconsultation and telemonitoring is going to be stay here, because it is the National Medical Commission is given the positive signal for accepting that. Yes, the human touch is lost there. When we talk about the person-to-person contact, when the person-centric medicine, when we are talking, when the doctor-patient relationship we are talking, that will be definitely missed in the telecommunication. And autonomy and the security of the data which you are sharing with a computer system, how far it is safe is still a problem. But India, like a vast country where we do not have adequate infrastructure for the doctors to reach, especially the consultant and the super specialist to reach that place, teleconsultation is going to help majority of the people in getting the expert opinion and translate that into action, get a positive health. So we wholeheartedly welcome the principle of teleconsultation. We welcome the telemedicine policy. But what we are expecting the government is put more monitoring of the control, so that the data are not leaked, data are not misused, and the more technology comes where the hidden interface between the human touch is not lost, and various other mechanisms are there now to enhance the human touch even through the telemedicine consultation.
Thank you so much, sir, for explaining it really well, sir. I will be taking last question for today's session from Dr. Subramaniam. He is asking, what can be the role of artificial intelligence in the healthcare sector? What's your point on this?
Absolutely. This is one of the great shift which is taking with the digital health mission and artificial intelligence. We are only in the infant stage. The bounty of the artificial intelligence implications are very, very high. But the challenge which we are going to get with an artificial intelligence is again the autonomy and the ethical concern of the patient. Now, when an artificial intelligence reads and CT scan and says this patient may have 20% possibility of a carcinoma, 30% possibility of a inflammation, and who is going to interpret that, and who is to take the moral responsibility of saying that it could be a cancer? Because artificial intelligence also now, without overall a structured frame, lot of startup events are coming, so that are ending up in intimidating the people and giving the people in a wrong direction. Lot of inputs are coming. That is a challenging. Third one is artificial intelligence are going to act like a big brother, so they are going to monitor you. Your privacy is gone. So there is also a big challenge which is going to in artificial intelligence. But it is inevitable. It is to come. Any technology is good, but it is all depends upon how best we are utilizing. The man is greater than the computer or the machine. When the man, the important of the man, important of his integrity is lost, the machine will definitely do a harm to the people. So what we say, simultaneously, when there is artificial intelligence is coming, everyone should be updated with the knowledge and skill so that they will be able to master it, control it, handhold it, and it should not go away from the man control or the human control. It should not be go only into the machine control concept.
Okay, thank you so much, sir, once again for answering this question really well, sir. I hope that all the doubts of the participant has been cleared, sir. I can see there is one feedback from Dr. Priyanshi. She has written wonderful topic and well explained. And has given the feedback. I heard that she has really enjoyed this session, sir. As there is no more questions, sir, with all your permission, shall we conclude this session?
Thank you very much.
Thank you so much, sir, and happy Doctor's Day, and take care of yourself, sir, and hope to see you again with different topic in coming time, sir. Bye, sir.
Thank you.